Come in.
Hello.
Hello.
Hi, how are you? My name is Moruph. I'm a nurse practitioner student from United States University. I'm going to be doing an examination on you today. I'm going to be examining your head, eyes, ears, nose, and throat. Is that okay?
Yeah.
Okay, what's your name?
Jason Parker.
Okay. What's your date of birth?
10/17/14.
Okay, thank you, Jason. How old are you?
I'm 8 years old.
Okay. So this is my patient. His name is Jason. He's 8 years old. So I'm going to start the assessment on him. The first thing I'm going to do is to assess his head. Here, yeah, I'm going to assess your head, and I'm going to start with the hair. Right now, I'm going to look for. I'm going to look at your hair distribution and the texture of your hair. Your hair is nice and thick, and the hair, I'm going to look at the back too on both sides, and also looking for the hair distribution. The hair distribution is evenly, your hair is evenly distributed. So I'm also going to assess for the shape of your head. I'm looking for any trauma, any rashes, or any lesions. So for your I'm looking at your head, assessing your head for any trauma, rashes, or lesion. I didn't see any. I'm also looking for the shape of. I'm looking at the shape of your head. Um, the shape of your head is normal. The other thing is that I'm going to palpate your head as well. Okay, is that okay? I'm going to be touching you. Okay, I'm palpating for any cyst, lesion, depression, or hematoma, and I'm going to look at the back around the area. I didn't see any lesion, hematoma, or swelling. So, based on this finding, your head is normal. The next thing I'm going to do, I'm going to test your visual acuity. What that means is that I have this chart with me. I'm going to move away 6 feet apart, and I would like you to read the best line that you can read for me. And tell me what line. What line?
LTFPH.
Okay. What line?
The very bottom line.
Okay, thank you. Can you close your right eye for me, Jason? Okay. Can you read the best line for me?
LTFPH.
Okay, what line?
The very bottom line.
Okay. Can you close your left eye? Can you read it for me?
LTFPH.
What line?
The very bottom line.
Okay, thank you. The next thing I'm going to assess is your visual field. So I'm going to use something called confrontation test to check your visual field, okay?
Okay.
All right. So I'm going to place my hand behind you. Tell me when you see my hand and what side.
Okay. I see here and on the right side.
Right side? Okay. How about now?
The left side.
Okay. Okay, how about now?
The left side again.
Okay. How about now?
Left side.
Okay. How about now?
The right side.
Okay, very good. So the next thing that I'm going to assess is I'm going to do like a general inspection, meaning that I'm going to look at the general appearance of your eyes, and I will look at your iris and cornea. Can you take out your glasses for me, please?
Okay.
So with this general inspection, I'm looking for bulging eyes. So I didn't see any bulging eyes. I'm also looking for ptosis, like a drooping of the eyes. I didn't see that too. Okay, look very good. I didn't see that. I'm also going to check your eyelid. Okay. I'm also looking at your conjunctivitis and your lacriminal system. Okay, I saw your lacriminal system. Your lacriminal dot is nice and pink. No drainage, no redness. All right. The other thing that I'm going to check here is your sclera. Okay, I'm going to pull your eye down to check your sclera. Okay, your sclera is nice, white, whitish color, no drainage. It's nice and white. Very good. The next thing I'm going to do is I'm going to check your eyes reaction to light. Okay, I'm going to use my light to check your eyes reaction to light. The first thing, I'm going to shine my light on your eyes directly on the right eye, and I will shine it directly on the left too. All right, to see how they will react. So I'm doing direct now. So your right eye reacted to light. I'm going to shine it on the left. Your left eye reacted to light as well right there. Okay, very good. I'm going to also do something called consensual. Okay, meaning that I will shine light on the right, seeing if I'm trying to find out if your left eye will react to the light that I shine on the right. Same thing on the left. I will shine light on the left to see if your right eye is reacting to that light that I shine on the left. Okay, so that is called consensual. Okay. Okay, very good. I shine light on your right and your left eye unreacted. I'm going to shine light on your left too to see if your right eye will react. Very good. So your right eye reacted too. So that's consensual. All right. The next thing I'm going to check is your extraocular motors. That means that I'm going to check your cranial nerve 3, cranial nerve 4, and cranial nerve 6. 3, 4, 6. I'm going to check those cranial nerves. So I want you to follow my finger, okay? All right. So I'm going to be going here. So that's on cranial nerve 3, which is oculomotor. All right. And I will be back, and I will go here. That's cranial nerve 6, and that's abducens. Okay. I'll go back here, and I will go up. That's cranial nerve 3, oculomotor. And I'll go back and go down. That's cranial nerve 3, oculomotor. Okay, make sure you follow my hand with your eyes, not your head. So I'm also going to go up here. That's cranial nerve 4. That's trochlea. I'm going to go back and go down on this side. So that's cranial nerve 3. That's oculomotor as well. Okay. So I check all those cranial nerves. The next thing I'm going to check your eyes for is called nystagmus, okay? Nystagmus is an involuntary eye movement, or dancing eyes, they call it sometimes. So I want you to follow my eyes so I can check it for nystagmus. To follow my finger. Very good. Very good. So I check your eyes for nystagmus. It's negative for nystagmus. The next thing I'm going to check is convergence. Okay, I want you to follow my finger as well. I'm checking you for convergence. Here, I want to see if your eyes converge or follow as I move my finger. Very good. Very good. The next thing I'm going to check is accommodation. Okay, I want you to follow my finger as well. So I'm going to, as I move my finger closer to you, I want to see if your eyes will constrict. Yes, very good. So that's accommodation. All right. And now I'm going to do a scope examination of your eyes. I have my scope here. Okay. One of the things with scope is we have to maintain patient safety, meaning I'm going to make sure I'm not using this to hurt you or cause any injury. So I'm going to brace with my hand as I move closer to you. So the other thing is my right eye will assess your right eye. My left eye will assess your left eye. Okay, let's start with the right eye. So I'm going to go down to your level. Can you look over there for me to the wall and straighten your head? Okay, I'm looking for red reflex right there. So I saw the red reflex. So I'm going to follow it to the back of your pupil. I'm going to follow it. I saw the blood vessels. I saw the blood vessels. I saw the blood vessels. So I'm inspecting right eye now. Okay. I'm following the reflex to the back of the pupils, and I saw the blood vessels. Optic nerve and margin are sharp. Um, Optic nerve and margin of disc are sharp. Disc to cup ratio is about 1 to 3. Disc is greater than cup. Retina is orange and bright with no cotton wool spot. Right there. Very good. Okay. The next thing I'm going to do is I'm going to look into your left eye now, okay? Again, I'm going to look for red reflex first. With my, I'm assessing you with my left now, left eye. I'm looking for red reflex. Okay. 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 Very good. I'm looking for red reflex. I saw it. So I'm going to follow the red reflex and look into the back of your pupil. All right. Very good. And I saw the blood vessels. I saw the blood vessels. Okay. Okay. I saw the blood vessels. Optic nerve and disc. Optic nerve to disc is very sharp. Disc to cup ratio is about 1 to 3. And disc is greater than cup. Retina is orange, bright. It's orange and bright with no cotton wool spot. All right. Thank you.
Wow.
So I just examined both eyes. Are you having any pain at this point?
No.
Because if you're having any pain, we can stop. So now I'm going to inspect your nose, okay?
Okay.
So let me change. So I'm going to inspect and check inside of your nose, okay? I have a probe here. I'm going to put it on top of the scope, all right? So can you move a little back for me? So I'm inspecting your nose. First of all, I'm going to palpate your sinus too, okay? This is frontal, okay? Any pain?
No.
And I'm going to go down to maxilla. Any pain?
No.
Okay. The next thing is I'm going to palpate your nose. Any pain?
No.
Okay. Look a little up for me. And I'm going to look inside your nose now. Okay. I'm going to look inside your nose to see if there's any drainage. Again, I'm going to maintain patient safety, making sure this is not really causing any pain to you. So I'm looking inside your left nose now. Okay. I didn't see any drainage. I didn't see any polyps. I didn't see any septum deviation. Okay. And I'm going to look in here too. I didn't see any drainage. Inside your nail is pink and moist. I didn't see any polyps or septum deviation. No redness or inflammation. I saw some hair growth on both nails, but there's no abnormal drainage or abnormal finding. All right. Thank you. Are you feeling okay?
Yep.
Okay. The next thing is I'm going to test your nose for airflow. Okay. All right. So I want you to occlude your nose for me. One of them. Press on it. Can you blow some air with your nose on my hand? Very good. Can you occlude the right one and blow some air for me on my hand? More. Okay, very good. So your airflow is good. So now I'm going to move to your ears. I'm going to check for your gross hearing, all right? So I want you to close one ear for me, okay? And I'm going to whisper on one ear. I just want you to tell me what I said, okay?
Okay. Apple.
Very good. And on this side, okay. Can you tell me what you hear on this side?
Chocolate.
Okay, very good. So I hear apple and chocolate. So that's good. The next thing that I'm going to do to your hair is I'm going to do Weber test, something called Weber test. So we use Weber test to assess conduction into hairs with tuning fork. Okay, I have a tuning fork here, so I'm going to assess for the conduction. You know, I'm going to strike this tuning fork and place it on your forehead, and I want you to tell me which of your hair do you hear the vibration or the sound from. If it's both hairs, tell me. If it's one hair, tell me. Tell me which one.
I can hear on both ears.
Oh, you hear it from both hairs?
Yeah.
Okay, very good. Yeah, it should be both hairs. So that's normal. So I'm going to do Ryan test now. So we use Ryan test to compare the hair conduction to bone conduction. We want to know which one is greater. Okay, so I'm going to vibrate this tuning fork and place it on your mystoid board. Okay? When you stop hearing the sound, let me know because I'm going to place it on your hair too. So you can tell me if you hear anything. Okay? So we're going to start from your mystoid bone behind your hair. Tell me when you stop hearing the sound.
I stopped hearing.
Okay. How about now?
I can hear it.
You can hear it. Okay. So that means air conduction is greater than bone conduction. So I'm going to do the same thing on your right ear. Tell me when you stop hearing the sound.
I stopped hearing it.
You stop hearing it. How about now from your ear?
I can hear it.
You can hear it? Okay, very good. On the right side too, that means the hair conduction is greater than bone conduction. Okay? All right, the next thing that I'm going to do now is I'm going to inspect your external hair canal and I'm going to look inside your hairs, okay? All right. So I'm going to look at your external canal. I'm looking for any discharge. Also, your vagus, I'm looking for any abnormality there. I didn't see anything. I'm palpating that. Your tragus, are you having pain?
No.
No discharge, no keloid, no pain. I'm palpating your tragus. The next thing I'm going to do is to look inside your hairs, okay? So I have my scope here. So I'm going to look inside your hair, okay?
Okay.
With a light. Okay. So I'm looking for any cerumen, any earwax or redness. Okay. I didn't see any earwax. So I'm inspecting your left ear now. I didn't notice any discharge. I didn't notice any cerumen or redness. Tympanic membrane is pale gray. I saw cone of light on the left ear around 7 o'clock on the left ear. All right. So same thing. I'm going to inspect your with light too. Also, I'm looking at your external. There's no keloid. There's no abnormalities. So I'm going to look inside your ear now. Okay, inside your right ear. Okay. Again, patient safety. I'm going to make sure this is not causing any pain by bracing. Okay. Okay. I'm looking inside your right ear now. Okay. I'm looking for any serum redness. There are none. Tympanic membrane tympanic membrane is pale gray. I saw cone of light in the right ear is around 5 o'clock position. Okay. Thank you. Are you okay?
Yep.
Okay, very good. So I just check your ears. Everything looks normal. Now I'm going to do your mouth, throat, and face. Okay.
Okay.
First of all, I'm going to look at your lips. Okay. Your lips is nice and pink. I didn't see any cracking. Okay. Can you open your mouth for me? Okay. And I'm going to use my light to look inside your mouth. Okay. At this point, I will turn. At this point, I will put the glove on. I'll put the glove on. Okay. Open your mouth for me so I can look inside your mouth, please. Do So I'm looking inside your mouth. Okay. Very good. I'm inspecting your salivary duct. It's pink and moist. I'm inspecting your gingiva. Okay. There's no swelling, there's no infection in your gingiva. I'm inspecting your teeth. Can I say your teeth is nice and clean on both sides and the upper teeth too? I didn't see any denture in your mouth. Okay. No abscesses, no deformities, no caries. I want to also inspect your tongue, okay? Stick your tongue out for me. Stick it out. Your tongue is at the midline. Okay. I'm also inspecting your papilla. The size is about 2 mm length and 0.3 centimeter width. All right. Open for me. Very good. Okay. I didn't see any abnormal in there. I just want to also inspect on the strength of your tongue as well. Okay. Can you sit upright for me? Okay. So open your mouth for me and stick out your tongue. Okay. Wiggle your tongue back like this. Very good. Okay. I also want you to use your tongue to eat your cheeks from the inside. Very good. Say ah, ah. Okay. Very good. Ah, ah. Your tongue is at the midline, and your uvula is nice and pink. Um, Say ah. I'm also inspect your soft palate, and your uvula is nice and pink. I want you to do a swallowing for me. Close your mouth. Swallow for me. Okay, very good. Swallow for me again. Okay, very good. And use your tongue to hit my hand on both sides. Okay, very good. Okay. Open your mouth for me. At this point, I'm also going to use like a tongue depressor. I'm going to put a tongue depressor inside to check your gag reflex. All right, that's the next thing. And I also want you to swallow water for me so I can check your swallowing strength. Okay. Swallow some water for me. Okay. You swallow, no problem? Okay, very good. I also want you to swallow for me while I palpate, okay? Just to see if you're really feeling any pain with swallowing. Okay. Okay. Open your mouth for me. I saw that your pharynx and tonsil, they're nice and pink and moisture. I didn't see any redness or swelling. So those are normal findings, all right? So now I'm going to assess your neck, all right? Can you straighten your neck for me. We're going to do some exercise. It's like a range of motion, okay? I want you to flex your neck for me. Any pain?
No.
Any pain?
No.
Okay. Any pain?
No.
Okay. Any pain?
No.
Okay. Any pain?
No.
Okay. Can you use your neck to push against my hand? Any pain?
No.
Okay. How about here? Any pain?
No.
Okay. Can you rotate your neck like this for me? Like that. Any pain?
No.
Okay. Very good. The next thing I'm going to do is I'm going to palpate your lymph nodes, okay? The first thing I'm going to do is I'm going to palpate your lymph nodes and the pre-auricular, okay? It's going to be before your hair. So I'm going to palpate it right here. That's pre-auricular. Okay. I'm also going to do post-auricular, you know, behind your hair right here. Any pain?
No.
Okay. I'm also going to do anterior cervical. That's the front of your neck below your shin. All right. Any pain here?
No.
Okay. You sure? No pain?
No pain.
Okay. I'm also going to do posterior clavicle, which is the back of your neck from the myster down. Okay. Back of your neck. I'm palpating that. Any pain?
No.
Okay. Okay. I'm going to do submental now. So it's going to be right below your shin. Okay. That's submental. Any pain?
No.
Okay. I'm going to do submandibular now. Right there. Submandibular. Any pain here?
No.
Okay. So I'm going to do supraventricular now. So it's right here. Any pain?
No.
Supraventricular is right here, below front neck. Okay, right here on both sides. Any pain?
No.
Okay. I'm going to do occipital, which is behind your neck, okay? I'm palpating it. Any pain?
No.
So I didn't see any lump on your lymph nodes. I didn't see any tenderness. You're not having any pain. The last one I'm going to do is on trachea. Okay, it's right here. Your trachea is right here. I'm going to palpate that. Any pain?
No.
You're not feeling any pain? Okay, very good. So the next thing I'm going to do is your thyroid gland, okay?
Okay.
Are you okay?
Mm-hmm.
First of all, I'm going to inspect, okay? I'm going to inspect your thyroid on both sides. Very good. Very good. I didn't see any abnormalities there, okay? So I would like you to swallow for me too while I look at your thyroid and tell me if you're having any pain.
No.
Okay. So on the landmark here is your ethmois. Your ethmois is right here. That's one of the landmark of the thyroid. And your cricoid cartilage is right there. Your cricoid cartilage is right there. Those are the landmark. Okay. I'm also going to palpate your gland behind here while you swallow, okay? Take a swallow for me and I'm going to palpate from the back. Any pain?
No.
Swallow again. Any pain?
No.
Okay. Very good. Thank you. This concludes our examination today. Do you have any question for me?
No.
Okay. Thank you for coming to the clinic today, and we're looking forward to see you the next time. Thank you.
You're welcome.